Have you ever wondered if you or someone you know is hypersexual, or do you just have a high sex drive? I'm Dr. Rena Malik, urologist and pelvic surgeon, and today we're going to talk all about hypersexuality. Now, hypersexuality is sort of a very controversial topic. There's no real agreed upon definition in the DSM-5, which is essentially a categorization of a number of psychiatric conditions. And so what exactly is it? So we're going to talk about what it is, what sort of things that might be causing it, and we'll kind of review what you can do or what kind of help you can seek if you're struggling with hypersexuality. So when you're thinking of hypersexuality, there's essentially three things that need to be happening. One is that you're having a preoccupation with sexual desires, sexual fantasies, or the act of sex that is really difficult to control. You're also having a lot of sexual behaviors, and that could be masturbation, that can be sex with a person, that can be telephone sex, that can be excessive use of pornography, and then lastly, that it's causing distress to you or your family. So the consequences can seem obvious and some are less obvious. So one is certainly you can get sexually transmitted infections if you're not having safe sex. You can have unplanned pregnancies, and these conditions can be sometimes serious. Obviously, this can be a huge strain on your relationships, whether they're romantic or not. It can cause a significant amount of distress and conflict in your relationships. It can cause your own personal loss of self-esteem and feeling lonely at times. And lastly, because you're so preoccupied with having sex, it may mean that you're not doing as great of a job at work, so you might have difficulty keeping a position. You may be spending lots of money on using escorts. Lastly, if you're engaging in some sex offenses, then you can have legal trouble. But this is not common, but it ranges in the studies from anywhere from 2% all the way up to 10% of people. So it is common enough that you may come across somebody who has hypersexual tendencies. Now, how have people defined hypersexuality? Like, is it the number of times, the amount of time you're spending? So there's actually a research group that sort of decided what the amount and frequency of orgasms are, which is sort of normal, and above and beyond that is considered to be abnormal. The way they figured this out is through surveys of tons and tons of men to identify how many times people are reaching orgasm through a variety of methods. That could be through partnered sex, that could be through masturbation, and they found that it was extremely rare for people to have more than 7 orgasms a week. And they described this as total sexual output. So based on this, they said any person, whether it's a man or woman, if they had a total sexual output of more than 7 orgasms per week that was sustained for 6 months, and they spent more than 1 to 2 hours on such sexual activities that end in orgasm, that this would be considered hypersexual. Now, this is a flawed definition, right? Because people can have lots of sex and have lots of orgasms, and it can not be detrimental to their quality of life. Or they could be preoccupied with sexual behavior, which could be problematic, but they're not actually having orgasms. So it's not a perfect definition. So there was a proposed definitions by a number of psychologists and psychiatrists to define what hypersexuality is. It had to meet at least 4 of 5 criteria over a period of 6 months. The first was excessive time was preoccupied or used up by either sexual fantasy, sexual urges, or planning for sexual activity. Number 2 was that you were repetitively engaging in these activities in response to dysphoric states. So whether you were anxious, bored, depressed, this was sort of your response to those feelings. And number 3 was the same, very similar, but repetitively engaging in these activities when you had stressful life events. Number 4 was that doing these activities, but really trying to control your time and obsession with sexual activities, but being unable to. And lastly, continuing these activities despite harm to yourself or others. In addition to having 4 or 5 of these things, you had to be an adult. You had to be bothered by the amount of sex you're having. And this couldn't be due to another condition like bipolar disorder, for example, or be due to a substance that you're taking. Now, a really great way to think about this is through a cycle that was described in one of the research papers I've linked down below called the Sexhavior cycle of hypersexuality. So the way you think about it is any sort of sex event starts with an urge. So you see something, hear something, feel something that gives you an urge for sex. You then proceed to the sexual behavior. So that could be masturbation, that could be sex, whatever it is, and you then go on to sexual satiation. So this is when that initial urge starts to dissipate and you're starting to feel sort of satisfied during the moment, and that urge starts to wane. This is then followed by post-sexual satiation. Post-sexual satiation is you've completed the act and your urge is pretty much gone and you're back to your normal baseline of non-sexual arousal. So the average person can have a sexual urge and not act on it. And the difference in hypersexual individuals is they have an urge and they really cannot suppress that urge. They have to act on it. Otherwise, they sort of feel out of control. In terms of satiation, normally people feel satiated for a longer period of time. So they complete the act, their urge goes away, and they're back to normal state for a significant amount of time. Now, hypersexual people can feel like they're never satiated or their satiety period is significantly smaller. The other interesting thing is that when they get these sexual urges, they go into this state called cognitive abeyance. Basically, all their logical thought goes to the wayside. They're no longer balancing the rewards to the risks of proceeding with whatever activity they're thinking of doing. They also may get in sort of what's a cognitive trance-like state. So they're just focused and completely 100% thinking about achieving that sexual urge and doing that sexual behavior to complete that urge. Now, before I get into the theories as to what causes hypersexuality, there is one argument that these people who are deemed hypersexual actually just have a high sex drive. And because of society's thoughts of what is considered normal, they begin to feel shame around their desire to have sex, and this becomes more of a pathology. So when in actuality, they just have normal sexual urges and they want to have sex, and this then spirals into a feeling like there's something wrong with them because of societal norms. So there are a few theories as to why people become hypersexual. And two of these that sort of seem very opposite but are on sort of a spectrum are sexual compulsivity and sexual impulsivity. Now, sexual compulsivity is essentially like people who have OCD. So, for example, when someone has a compulsion, they get a thought that is so difficult to ignore, and the only way for that thought to go away for them is to do the action. So very similarly, it's thought that people who have hypersexuality get these obsessive thoughts that they need to then proceed to complete the thought, in this case, the sexual behavior. And so these sexual behaviors may be a way that they seek to self-soothe themselves when they're having significant anxiety, depression, or mood conditions. On the other hand, impulsivity is essentially the inability to resist the urge to have sex. It's sort of similar, but in this case, though, when you have the act, you get pleasure, right? And that pleasure then reinforces the desire to go be impulsive again and try and achieve that pleasure. And so very often what these people will feel is they'll feel this strong sense of tension, which then during the act, they feel this immense relief and gratification. And then after the act, they feel guilty. But the cycle then repeats itself. And so the way to think about this is compulsivity is using the act to get away from negative feelings like anxiety, stress, depression, whereas impulsivity is using the act to get pleasure or get a positive reward. And so they're sort of, again, like on a spectrum. Someone can be using it, can kind of fall into either of those categories. Another theory is that hypersexuality is a trauma and sex disorder. What that means is that people experience trauma and stress during their childhood, and this trauma then leads to them having difficulty regulating their body's normal systems of desire and arousal. And so then they go on to have difficulty forming intimate relationships with normal levels of sexual desire and arousal. The other thought is that this is a sex addiction. Now, addiction by definition has a few characteristics. One is that you need increasing amounts of whatever thing you are addicted to achieve that same level of pleasure. So in this case, sexual behavior. The second thing is that you begin to have a dependence on the substance or thing that you're addicted to. And then also that you have withdrawal symptoms when it's taken away. You need more and more of the same substance to achieve the same kind of satiation that you did previously. So in order to kind of fulfill the addiction, you no longer need sex once a day, you need sex twice a day, 3 times a day, so on and so forth. With it, there's a desire and a realization that you're out of control and you've either wanted to or tried to control the addiction while being unsuccessful. In addition, you'll spend a lot of time engaged in the activity that you're addicted to. And lastly, you'll continue doing the activity despite knowing that it has negative consequences to your psychological health, your relationships, or your physical health. When they've looked at brains of people who have hypersexuality disorder, or what they've thought to be hypersexuality disorder, they've seen increased activity in certain parts of the brain that are involved in pathways of motivation and reward, as well as memory. And so these areas get highly activated so that when people have sexual urges, their motivation for them is higher, and their reward response is higher. Also, they may have dysregulation in some of the frontal cortical parts of their brain, which then cause difficulty in making good decisions, essentially impairing their judgment and enhancing their impulsivity for sexual behavior. Now, when you think about sexual excitation or inhibition, we know that certain parts of our neurotransmitters and hormones are responsible for increasing excitation, and that can include things like dopamine and testosterone. So we see that in certain medical conditions or certain medications that you take for certain medical conditions that there can be more hypersexuality. For example, people who have Parkinson's disease often take medications that increase dopamine. And so when you increase dopamine, they tend to have more hypersexual behavior. Similarly, we can see it in people taking medications for seizures, people who've had brain injuries to those areas, or who have dementia. Now, what can you do for hypersexuality? So certainly you need to see a psychiatrist or a psychologist to discuss the issues at hand. And there are a number of medical and psychological treatments available. Let's start with medical. You can take antidepressants or selective serotonin reuptake inhibitors. Now, these medications increase serotonin, and serotonin actually causes inhibition of sexual thought. So these can be very effective in improving hypersexuality. Similarly, medications like anti-androgens reduce testosterone, which is also involved in sexual desire or excitation. Other medications similarly can work to act on the hypothalamic pituitary axis to then reduce the production of LH and FSH, which are hormones that then cause testosterone production. Other medications that have shown some benefit include naltrexone, mood stabilizers, antipsychotics, and even anti-anxiety medications. In terms of psychotherapy, using things like cognitive behavioral therapy, which allows you to sort of change your thoughts around those sexual urges and replace them with more positive things, using acceptance and commitment therapy, which allows couples to work together to change their relationships with thoughts rather than the actions themselves, or motivational interviewing, where they go through with the person, where the psychologist or psychiatrist will go through and see what your goals and values are to help you elucidate where you're struggling and help you find solutions. Hypersexuality can be a really serious problem. So if you're watching this video, I encourage you strongly to get help from a psychologist, from a psychiatrist who can help you work through these issues. This is going to take time and effort and energy, but you will get through it, and it is really important to get help. By the way, I have to let you guys know about my new podcast, which is already up on Apple and Spotify, sharing some of the older interviews that I've had on this channel. But starting December 8th, you will see brand new interviews, both here on YouTube and on Spotify, Apple, or wherever you consume your podcasts, from the Rena Malik MD podcast. I've already started interviewing some of the most fascinating people, and I'm continuing to find so many cool and interesting people to join me on the podcast every single week. And as always, remember to take care of yourself because you're worth it.